And we're back on the program. Joining us again today, Dr. Thomas Hirose, who's one of our local doctors here specializing in, well, blood and our blood diseases and Coumadin management for a lot of our folks in the community, but other aspects of blood as well. And last time you were with us, we talked about some of the blood testing that we get done by our doctors and some of the factors in that. Today we're going to talk about some things that unfortunately affects too many people, and that's bleeding disorders. And we hear about things like hemophilia. I think a lot of that, didn't we hear stories about that being caused in Europe by a lot of the inbreeding of the royal families?
That's correct, and there was such a forensic search for the heirs of the czars who had hemophilia A, which is factor VIII deficiency. So much research and development has been just uncovered in the last few decades. But the ability to stop bleeding is a remarkable system, and it's primarily 3 spots in the body, factors made inside the bones themselves, the powerhouse or machine factory of clotting factors being the liver, and then lastly, what a marvelous system to have locally. So when you cut your skin, the blood vessels themselves actually release clotting factors. And as it turns out, the factor VIII hemophilia deficiency is actually at the blood vessel level, whereas another very common disease known as von Willebrand's disease is also at that site. It's a good message because the most common deficiency is this disease called von Willebrand's disease, and it actually affects men and women equally, and the carrier rate is as high as 1 in 200 to 1 in 400.
Amazing, amazing. Well, a lot of us have heard about people that have bleeding issues, and that may be in fact the medical definition of it, but none of us here in the staff had ever heard that term, von Willebrand disease. Do we know what causes it?
Yes, it's a genetic absence of a segment of the DNA, and so a protein is not made that helps you stop to bleed. And
so let's talk a little bit about then, first of all, how you would test for that.
Very common test that we use for evaluation for surgery will pick up the deficiency of this disorder, and the most powerful signal that you may have this disease is actually too much bleeding at the time of teeth cleaning, too much bleeding at simple surgeries, and certainly a family history of abnormal bleeding. And that's the thing that we really focus in on to screen the patients first.
Right, so it's a genetic situation.
Yes.
How do we treat it? How do we replace what's not there?
That's the key question. It depends on what type of procedure is going to be done, and it depends on information to protect a patient for unexpected injury. So we have clotting factors in the blood bank, and we actually have medications that are available in the pharmacy that will treat von Willebrand's disease. So very specifically, we can stop any type of hemorrhage, and we can prepare for hemorrhages as well.
I understand there's also different types of von Willebrand's.
There is. And the most simple and most common deficiency is you're missing a little bit of all the different types of proteins. That's the type 1 disease. And that's the one that's about 0.5%. And simply speaking, if you have this disorder, you could go your entire life and not have a major bleeding episode. But it's certainly something worth knowing just before you go to open heart surgery or major surgery, so you can prepare for it.
Right. And then type 2?
Type 2 disease is where you're missing the majority of the size of von Willebrand's factor. So the protein comes in large size, middle size, and small size. And in the type 2, you're missing the whole thing. And so this disorder is the most severe disease. And typically it presents itself in childhood or in the adolescent years with a major bleed from minor trauma.
Right. Right. And then the third type is what? The
type 3 disease, since there's large, middle, and small, you're missing the larger factors. And then the type 4 is interesting, is that the protein lives not only circulating in the blood and near the blood vessels, but on the surface of the third element, which is platelets. And this is platelet type von Willebrand's disease. That's very rare.
All right.
Yes.
Are these things we normally test for in routine blood tests?
We do a screening test, and when you go to surgery, you usually have a blood count to see if you have normal number of red cells. The second is that you look for one test that we do in the Coumadin Clinic for Coumadin is called a pro-time. And the third test is called a partial thromboplastin time. And we know by the combination of it either being too high or too low whether there's an underlying deficiency that's genetic.
I know a lot of people take anticoagulants to prevent clotting to try and prevent strokes and heart attacks.
Yes.
And a lot of us take 81 milligram aspirin. A lot of doctors recommend that as a kind of a preventative measure for staving off heart attacks and other problems. I understand normally when someone's going to go in for surgery of any kind, they usually recommend knock off the aspirin and maybe even knock off the anticoagulants for a few days.
That's correct. And so if you knew that you had a genetic disease giving you bleeding, we would actually probably give you something before the surgery to make sure that you have a good course during surgery.
Right, right. So you'd actually have, you'd be prepared, you'd be covered
Yes.
through the surgery procedure, yeah.
In some instances, we would prepare it ahead of time, and in other instances, we would actually give it before the surgery.
Mm-hmm. All right, so there again, pre-surgical testing is one of the things that people say, you know, just take me, I want to get this over with, take me in and do the procedure. And you normally have to go in a day or two ahead for testing for a variety of things, and that's one of the things you look for is the ability to clot and recover from the incisions that will be made.
That's right. You can only imagine how complex it gets when we put an anticoagulant on top of that. And so all these factors become part of the equation to make the patient safe for a procedure or safe just in general.
Right, right. Some important things going on out there. We mentioned hemophilia at the beginning. Is that the problem that it has been in the past, or has that gone away to much extent?
Well, that's such a timely question. The genetic diseases, the United States has done such a good job in counseling and in identifying and preventing disease that the number of hemophilia patients has diminished. So much so that the foundation, which has done such a tremendous job in protecting these patients, are broadening their scope, and their charter now is all coagulation disorders. Yes.
And I understand there's also some bleeding disorders that are specific to folks who are Jewish.
That's right, and this is the powerhouse of clotting factor production is the liver. And Jewish people of Ashkenazi origin have a very specific genetic deficiency, and it's called factor 11 deficiency. In certain suburbs in New York, it rivals von Willebrand's disease, about 0.5% of the population. So that's another thing that we screen for with these routine testings.
All right. Very important that we do all those things the doctors ask us to do, and that includes some of that testing, which we sometimes think is maybe unnecessary, but in fact it can be life-saving, especially in surgical situations. As always, we thank you for joining us and giving us some good information. Thanks for coming by today. Dr. Thomas Hirose, and of course, his testing procedures and clinic right here in our community, did a great job of helping to keep everybody well and keep all those chemicals in our bloodstream rightly balanced at all times. We'll be back with more right after this brief timeout.
I had 2 open heart surgeries when I was 29 years old. I was told that I was going to have to take Coumadin for the rest of my life. For 15 years, my ProTime went unregulated.
If you're on Coumadin, you need to be evaluated by a physician every 3 to 4 weeks.
At the Coumadin Clinic, I get my blood drawn right away, I get the results right away, and I'm seen by a real doctor. Since I've been regulated, I've been able to do my gardening, my stained glass, and I ride horses.
Laguna Hills Coumadin Clinic is located on the Village Bus Route.